public comment. Any comment from our public? Nope, okay. Approval of the consent agenda. Has everybody had a chance to go through, take a look? We've got some amended minutes and some... No problem.
I will approve the consent agenda as written, please.
And I'll second that.
Okay, been moved and seconded to approve the consent agenda as presented. All those in favor?
Aye.
Okay. Went unanimously. September 2018 financial report. Cheryl, you're on the hot seat.
All right.
And the meeting is now open.
Okay. So,
Sorry.
September, so this is the report for September, this first, in the first quarter of the new year. Our total hospital patients were 311 for September. Our last year's monthly average was 334, so that's a little bit low. We were down 189 patients year over year. That's a 17% decrease. You see the decreases in the ED, 15%. And surgical outpatients was down 38%. Swing beds were kind of down, which is a little surprising. I don't know the obvious reason for that, except this month has been better for swing beds. Ancillary services continue to be very, very strong and keep plugging along. So lab and radiology are above last year's numbers, and they're at 4%, 7%. Home health is in a slow month, but that's not unexpected. And the health clinic is showing a little teeny bit of growth. And rehab is still very strong. It's really just right where we kind of thought it would be. So. Our gross charges for the month of September were $2.85 million. The average is $2.9 million, so a little bit below average, which is not terrible. Our payments received on AR were $2.38 million, which is quite well above our average, $1.9 million. Normally I would have the next month in there, but then since this is the 1st of November, we haven't finished posting the month. It's from October, so I can't tell you how that looks. Our days in AR dropped to 79. Do you wish to speak? We have been doing a lot of work on it.
Sure, we have been doing a lot of work on it, and we ended up at about 1.8 million or so for the month, but we don't have an exact number on that.
For October.
For October, for collections for October. So we've had, we were reaching out to RICAN and kind of holding our feet to the fire, and we made some really good progress. And we had an hour WebEx with the team, and they also had a call with Charlie, Cheryl, and myself, and they did some reporting for us, which I'll share with you. When we were on the call, they were able to fix some of our issues real time. We didn't get everything finished. We have a call scheduled for every Monday until everything's resolved, and we're going to start focusing on what's holding our AR days back, which I'll cover a little bit in a minute. And then they're going to be here November 12th, 13th, and 14th, and we're going to have a workflow optimization specialist who's going to meet with the group as a whole, and then it's going to sit with each person individually and watch how they use the system, so that if they have ways that we can use it easier or faster or better, they'll show us how to do it. So they've really stepped up and they're helping us resolve.
Is this an extra cost to us, or?
No.
No, okay.
Yeah, because when they offered to come out, I was like, no, we already paid for you guys to come out when we went live with claims, and she said, no, well, we won't charge you for this.
Okay, good.
So they are stepping up to the plate. So from the report that they did for Charlie, they did a breakdown of our days in AR. So, and the numbers actually don't sound as bad as when we look at it being 79 or 80 days in the AR. So through RICAN, it's really just our insurance claims. So they have our billed but unpaid days at 44, which is good. And that's the portion that I feel like we can control more, because once we bill the insurance companies and then we follow up on them, and that's really where we have control with the business office. And so we're focusing now, which I did mention last month, is like the pre-billing issues. So the way they had it broken down is in our unbilled AR, we have 11.6 AR days sitting. And then for unchecked, we have 9.6.
So pre-billing is processing through medical records. It's waiting for the doctor to get done dictating and getting all of the file completed so it can go to billing. So part of that, it really should take about 4 to 5 days to get it through medical records to bill, but it's taking 11, so we're gonna work on that.
Okay, thank you.
So with those things combined, we're at about 65 days if we exclude private pay, which we really
Contracted payments.
It's contracted payments, right? Because we really don't have that much control over that either. You know, payments, our patients are payment plans, we, you know, just honor
We're
their
choosing
payment
to do
plans.
Yeah.
Now, your term contract, is that the private pay that you've extended?
Well, so private pay means either you don't have any insurance and you're paying the whole thing,
Yeah.
or your insurance paid and the balance is yours to pay, $1,000 or $200 or whatever it is. So then it's in this private pay category. But unless you sign a contract and you say, yes, I'm going to pay this off, but I gotta pay it at $100 a month or something like that. And we make an agreement with you about it, because then if you don't make a payment for 3 months, I think, then we send you to collections and you go through the process. But as long as you adhere to the terms of the agreement, and some people just make payments and don't want to sign an agreement, and again, we're usually okay with that, as long as they keep making payments.
Yeah, too.
Right. So that's kind of what that means, but we prefer to have an actual agreement with people to sign a contract. Okay. That's it?
That's it.
Thank you.
Thank you.
Do
Yeah.
you have any other questions, Lisa, while we have her?
No, I appreciate the breakdown, particularly the unbilled.
And so the unbilled and unchecked are two different things, although they kind of go hand in hand. So the unbilled is when we're still waiting for it to go through the process. And then the unchecked is when we've gotten a request for additional information from the insurance company. So it's been billed and we're waiting for additional information to send to them. So they're two different categories. One of them is solely on, you know, the coders or doctors or whoever, and the other portion is shared with business office.
Is the additional information request usually related to us not sending them enough stuff?
Sometimes it's for medical necessity or additional medical records or coordination of benefits or something like that. So
Like
there are,
when they think it might be work comp.
right.
So have you ever received a letter from the insurance company that says, how did this accident happen?
Right.
Were you at work when it happened? You're like, no.
But we don't include that in our.
But if you take 2 months to
Original.
answer the questions, we're stuck. They'll just wait, and they will deny the claim because
Yeah.
you haven't answered the questions.
Right.
So, and we do harass people, hey, by the way, we need you to fill out that form and send it back.
But we can't do this with the claim itself.
We can't do that for them, and we just have to wait for the patient to get it done. So, okay. So our days cash on hand is up, and that's good. It's up to 82. We really need it to be 90. A couple of our challenges this month was, well, it's not in October, but was we paid Detroit. Again, we paid Detroit, but we haven't borrowed. I did just send in, I sent in the bond borrow request today, actually. And I wasn't in too much of a hurry because I knew that Gene is scheduled for next week. Gene has to come out and do the inspection, so I knew I had, and he could come next week, so.
Every time we ask for a draw, the bank, Washington Federal has an independent architect to come out and make sure that what has been done meets with what the billing from Detroit as the contractor. You know what? So whenever we get a billing from Detroit, then we submit that to ZCS, and they verify that the billing is accurate, the percentage of work done, the claims. And so before Washington Federal pays, they have an independent architect who comes over from Ashland and inspects the documentation and the facility to make sure that it complies before they release the money. That's who she is.
So we have to kind of coordinate with him. I knew he couldn't make it till next week, so that will help. That money will come in November, the 750 almost. The property taxes will come in November. So November should look better. October probably will not be over the line either.
The property tax billing didn't go out until just a few days ago.
Yeah, but a lot of people pay in November. I mean,
Well, they'll pay in November, but
Yeah.
October you won't have
No.
the property tax receipts.
no, we won't. No, we usually get in November. That's why I say in October's not gonna, I don't think October's gonna totally bounce back. But by November, we'll have the borrowing on the bond and we'll have the tax dollars and it will get better then and stay better for a while. All right. Profit and loss for September, our net revenue was $2.2 million. It was 334 less than what we budgeted it to be. Expenses were 192,000 under budget. Where are they? Fine. Total expenses, $192,000. It's under budget. Our net loss for the month was 67,000. So we were 94,000 less than budgeted. Year-to-date, issues with the month and the year-to-date, I mean, I think you can tell by looking at the detailed P&L that has lots of surgery, lack of surgery. And that's not going to get better in October either because we've been doing remodeling in the surgery. So Dr. Chang's been here, people really like him, he seems to be a hard worker, but we don't have an OR for him right now. But
He's done some cases.
yeah, he's done some. So again, year-to-date, our revenue is 796,000 under budget. Our expenses are also under budget. Our net loss year-to-date is 265,000, and that is about 350,000 less than what we anticipated it would be. Balance sheet changed very, very little. Cash is up because we collected a lot. The AR is down because we collected a lot. The assets went up with the building payments. But really the net, the balance changed by about $200,000, so very, very little change there. Any questions on Mike?
Question for Charlie. Because our census seems to be going down quite a bit this year, are we doing better population health, you think, or not?
I was just talking to Dr. Gallagher about that, and he said, you know what, I can't predict why census was down.
Even if you look at your 2015, 16, and 17, you have that little spreadsheet in the back, it's been down in acute
Keeps going down.
every year.
But that's a national trend too.
And our outpatient services is continuing to be robust.
And
We've decreased
lab
our
and rehab.
readmissions dramatically.
You decreased them?
Decreased our readmissions dramatically.
That's good.
That's what
Mhm.
Medicare wants, because then they pay out as much.
Yeah, and the stays are a little bit shorter.
Your
The average of the stay.
stay went up, didn't it?
The length of stay,
Length of
the number of
stay.
stays. It might have been for the month, but over time, it's
Down.
yeah, it's trending down. So,
If you have that, well, you probably don't have that one spreadsheet there.
no, I didn't bring it all, but. And, yeah. Okay.
Any other questions? Okay,
All right.
next.
Lakeview Gardens, in long-term care, we had about 18 patients this month. In the assisted living facility, we had about 7 patients all in. Our revenue for the month is right here. It was 198,000, just a little bit below average of 200,000. I have to change the colors on this. For September, this contract labor continues to be a huge factor. The rest of the expenses are about average. month to month. So our net loss for the month was $157,000.
How many people do we have in Alf now?
7.
We have 7, we have one more moving in on Monday.
Okay. And any other projected for the rest of the year?
Not that I know of.
Yeah, so some more people to come. Okay, so this is the last time that we're gonna look at Goose Lake Medical Services on its own. Next month, it'll be folded into the hospital's financial statements. Quickly is gonna fold in last year's results into the hospital's financial statements because the change to become a department of the hospital was retroactive, so.
Do you want to talk about what Gage is working on?
Sure, yeah. So we've spent the last few days making sure we understand. We had to go into Medicare system and change the NPI number for Goose Lake. So, you know, Medicaid has all these numbers for you, your Medicare number and your NPI number and your tax ID number and all these numbers, right? So sometimes you need to get a new one and sometimes you change the name of the owner. So apparently we changed the name of the owner, so we've gone in and done that. Kate Joe has applied to the powers that be for us to find out what the rate will be for them to do a rate setting exercise and let us know what our rate's going to be. And then the next thing, of course, once we are certain of our numbers, is to rebuild all of those bills. And Katie Joe is thinking that instead of, in order to rebuild, we have to refund Medicare. We have to cancel all the old bills and refund their money. And then rebuild with the new amount and wait for the money to come. So she's thinking that she might be able to just refile the cost report and just show it so that it would be like one big bill swoop instead of
giant
having
bill.
to go back and refill everything. So I'm hoping to hear back from her in the next few days because that would save them and us a lot of time and pain.
Yeah.
So, but if not, we will be off and running, rebilling Medicare.
And we did actually hold our Medicare claims billing until this happened. So if it was coming up to timely filing, we billed it. But if it wasn't, we were holding it so we didn't have to go through this whole process. So once we got all the new rates, we could just shoot those out the door.
So any timeline on that?
No, except that I would say, I mean, I've thought about that. You know, the people within Medicare that we're working with now are very different from the people that we were working with on the license change. So these issues with the cost reports and the billing usually happen much, much, much faster. So I'm thinking days and weeks instead of months and years. And Katie Jo, you know, we talk to her about every other day. So she's been very helpful.
So Cheryl, this is the last Goose Lake medical like this we're going to see. How will we as a board know how they're doing?
It'll be its own department and your
Its own-
detailed financial statements. So,
It'll be in with the clinics.
no, it'll be a separate clinic. It'll be
Okay.
its own standalone.
Okay.
It is a very separate RHC and it's got a separate number and everything. Really, the thing that will change is you're not going to see the benefits within other financial statements. The benefits are all down at the bottom. So you won't see that factored in here. Although in most cases, when you're looking at the financials, like when I look at Wellness Center, you know, I think to myself, are they paying for, if I take 30% of their wages, is their bottom line covering their benefits? So that's kind of the number I use. So if it's not at least
What's the percentage?
30% of wages paid for that department. So, yeah, so that's really the main difference. You'll see the revenue, you'll see the expenses, the wages, just not the benefits in the detail. So, they lost $6,000, $7,000 this month, and their loss for the year is $34,000. So their revenue is trending up from last year, and notice that their expenses are trending down. So that's good news. All right. this is food and medical supply, DME. They had a good month. They had a net profit of $8,039.
Why was salary $3,000 lower? Are you waiting for another cashier employee or something that wasn't there during that period?
Yeah, we are, yes, looking for a couple of people.
Okay.
We're sort of filling our need for a really good full-time person with a few part-time people.
You're gonna follow your Facebook page to find out what they're trying to hire.
It's true, it's there.
I follow the grandkids on Facebook. But all I keep up with. Thank you.
I mean, you're not inundated with election information. Good.
Okay. The construction update.
We have the EMS building budget because we, up until a couple days ago, we were talking about that today. I kept that on there because I have met with several members of the ambulance group, and we are meeting next week to go over the issues. In concept, they are very interested in providing the board with a letter saying that they will invent and that working on the terms, we're working on it. So
Great.
they're very interested, and even yesterday we had members of the group talking with Detroit Construction. As it turns out, the drawing that I gave you, had I looked at my email Monday night when I was off at the North Lake board meeting, I would have gotten different information, including a different layout that had the reduced staffing, just like you had suggested, or not staffing, the area for staff, just like you had suggested, that they had made some adjustments. So it is moving forward on that. We have for you a letter, a card to sign.
Very nice.
Oh,
We'll have it go out tomorrow.
Very well done, Charlie.
is that okay?
Nice letter.
Yes.
Okay. I think there was just a challenge of where the letter went that prompted him not getting a copy of that, or getting the letter itself. And I just didn't think it was appropriate to email. So, anyway, in terms of the clinic remodel, we anticipated being able to move into the specialty clinic in the first part of November when they finish. But it turns out that it's easier for our crew that have been storing the furnishings to assemble all of it at one time. So they've been working on assembling those things, the tables, the chairs and whatnot. That's all in a storage space. And because all the chairs came in one big box, well, you'd have to separate out chairs for the expanded clinic from the specialty clinic, and they just said, could we wait? I said yes. So we are, as of yesterday, pretty confident we will have the building finished for the inspection by the week of the 26th of November. And so we're scheduling the inspector to come from Salem for that inspection. It's anticipated that there will be some things that they'll have to find, punch list items, and there may be changes. So we're planning that we would be able to start seeing patients in the expanded area the week of the 10th of December. Still way ahead of our December 31st completion. So that's our plan. It's moving along pretty well. If you haven't seen the changes, you'll be very pleased. So, questions about that? I think I've sent out the dollars where we're at. We talked a little bit about that before. That hasn't changed since our discussions. But I can change since Any other questions about construction? In terms of the operating room work that they're doing, sterilizer has been installed. The room where so as part of this remodel, what we're doing is we're putting in the new sterilizer. It's a larger sterilizer. We're putting in a new washer. So it takes from the soiled utility, goes into a washer, and then into a clean utility where they wrap all the tools and instruments and then put them in an autoclave and take that out and store it. So the washer will be, they'll hold off for a couple of weeks on that, in part so that we don't disrupt any of the surgery, and we're trying to space it in between. When Dr. Chang's here, when Dr. Bradley's. Another component of that, they're taking over the space that was used for anesthesia, where they have their carts and they do their preparations for the anesthetic that the patient is getting. And that's going to move into where nurse managers and nurse staff work had been done. They're going to be relocated over to where the old business office was. And in that location, now they will have finished that space. They were putting the coating in just a couple of hours ago. So we should be able to move that, remove the doors. So the second phase, we're putting in the washer and all the plumbing connected. So we're moving forward.
So how long before they have that completed?
The second phase, depending on if everything goes well, it may be the first part of December. Some of it is how quickly do the plumbers get here? Can they stage it correctly? And we had to work with the manufacturer, Steris, to make sure everything was set. As an example, while they were in the midst of it, they needed to have special architectural or engineering verification of the bolts for the seismic, so for earthquake control. That had to be done on Monday. That was a Steris report. Any questions about that?
Nope, it's going to get quiet when we get all the construction done.
That'll be a good thing.
Teresa, are we ready for the nursing report?
Well, I got on the agenda, but I wasn't planning on saying anything, so I don't know what to say now, you caught me off guard.
You didn't take off, sorry, after you told me this afternoon.
I'm trying to think, I just can't think of any news. It's just been super, we're delivering babies like crazy this month. We're onboarding all of our new nurses, and it's sort of crazy busyness as usual.
So no news is good news.
I think so. Yeah. Sleep lab is incredibly busy. We're booked out through February, and we just hired a PRN sleep tech that comes to us like every other weekend now from the Medford area. And we have a new respiratory therapy person in cardiopulmonary, and she has started kind of adding some additional testing and some additional therapy. So we bought a few small pieces of equipment for that department. So I look forward to that department maybe having some additional billing items, but nothing really very outstanding.
When you say on your onboarding nurses, is this the trainees?
It's the trainees, so 3 graduates out of the KCC program, 1 graduate out of a program back in the Midwest, and then we had already onboarded 1 person, Hope, from the OIT program. So lots of orientation and onboarding and filling out papers.
Now we'll go around.
Yes. Did I leave some?
Rural nursing program.
The rural nurse residency
Nurse
program
residency.
is going well, and I reported on that last time, so we're like a third of the way through that program. So that's why I'm doing grading papers.
How's your flu program going?
Well, luckily, our vaccination rate is going well. In fact, we're running out of vaccine, which is not a good thing because we're not quite done yet. But we've gone through, well, before today, she did another clinic today. She had done about 240, yeah, 240-ish. And she's doing the Lakeview Garden staff as well. So she's really been going through a lot of folks. We still have some declinations. We haven't had mask on date yet because we need to have two, either through the state lab or through our lab, and we haven't had that yet. So we haven't had any positive flus in our lab yet. So.
Good.
And we did get a report that came out. We were one of the lowest in the state in terms of our vaccination rate to where we are right in the thick of where we should be. So that's Mesa's been doing a great job, and the staff is now getting more vaccinations, which means we had last year, we were fortunate that we had very few cases relative to outside of Lake County. The number of flu cases that in other communities were running rampant. We did not have that. And that's good for our community. So, makes a difference. And we're very happy with all those that get their flu vaccinations.
Yeah.
Just so that you know, in the state of Colorado, you can't work in a hospital if they haven't had a flu shot. It's a law.
How about the public health part of the flu vaccination?
They are getting their vaccinations now. I don't have the numbers right this moment. You can get that.
We started a little after we did.
They started the 22nd, but Judy told Mallory, because Mallory's been doing the advertising for, Judy said within their first 2 days of their clinic, they were slammed. She didn't give us numbers, but she said they were hopping the first 2 days of it, so.
Okay. All right, so Dr. Graham.
In the absence of Dr. Graham, I'd like to present what the board, what the medical staff approved. I think we sent this out to you,
Yeah.
listing of all the renewals as well as the resignations. The medical staff has recommended that you approve this list.
I would make a motion to approve the list as presented to us.
Second.
Been moved and seconded to approve the medical staff privileging as presented. All those in favor?
Aye.
Passes unanimously.
Thank you. Thank you.
CEO report.
But before I jump into
Oh.
that, I do want to, didn't have listed on here our employee of the month. So I'd like to talk a little bit about that. Every month we try to find someone who has really shown their dedication and commitment to our community. We have many, many people, so it's not always easy to find a person that stands out. We have in all the different places that we are delivering service, we have impacts in many different ways. And the individual this month is someone who takes care of patients in the north side of the county and has done an exceptional job, and most recently got her certification as a licensed professional counselor. Haley Roy is her name. She makes a big difference in a community that is sometimes short on services, and so she works very, very hard. Has been in the community for quite some time, really makes a difference. Haley Roy is our lawyer.
Good.
So first off, I want to thank everyone for going last week to Burns to the presentation by Jamie Orlikoff. I think it was a valuable thing for everyone to hear the kinds of information, although I don't necessarily like the negativity of some of his thoughts. But, you know, that comes with the territory, so I appreciate that. On Monday, we were visited by Greg Walden. Congressman Walden was, and I appreciated Jane and Gerald coming to meet with Congressman Walden. He was here to talk about the support that he offered to a grant that we just got, $200,000. I think I sent out material about that too. And that was certainly an issue that Congressman Walden was very interested in. And this will help us work with not only Lake County, but Klamath and Modoc County. And there were representatives from Klamath at the meeting with Congressman Walden. I think it was a good opportunity to talk about some of the issues that we're dealing with. This will be very, very helpful for us. We had on July 5th, a survey by the federal government on our 340B program. You may recall we talked about this. We got our results this week, and of all the 340B drugs that we process, remember the way the 340B program works is the doctor writes a prescription, we fill that prescription. Oftentimes they're very expensive drugs, sometimes they're not. Sometimes we deliver that in the hospital, sometimes the patient goes and gets the medication in an outside pharmacy. Our responsibility as part of that is to track what patient gets that and do they actually qualify for the 340B program. We don't actually get a lower purchase price. But what happens is we buy it at the less price and the manufacturer restocks the price to us at a lower price. It's a complicated, convoluted process, but that's what it does. In our survey, they found one error. It was a patient that went to Walmart in Klamath Falls. It was an outpatient medication, and we're sorting through with the agency that handles the processing of that. It's one medication. So I would say that's a pretty successful audit and found virtually no problems. So I think that's pretty good too.
Charlie, how did you calculate the dollar benefit to us?
If we buy the drug at $100, and when it is restocked, it comes back at $35. That $65 difference is the profit, if you will. And for us, right now, the program that we're engaged in, it is roughly between $140,000 and $150,000 benefit to the district, all the medicines together. One of the things that is being discussed in the 340B program right now, we don't have to define exactly where that money is used for. It goes into our general fund and we can use it for. They're asking that we define exactly what we're going to use that money for. So whether that $150,000 or $140,000, and it varies by year, depending on the medication the patient is given. Many times they're oncology drugs, which are very expensive. So if you have somebody who's very sick, they could get a lot of that medication. They may ask that we use that specifically for some pharmacy service or some other defined purpose, but that's not the case today. That's how that works. Tomorrow, we are interviewing on site a psychiatric nurse practitioner. We'll see how that goes. We interviewed her Skype interview, but she'll be here for an on-site visit. If all goes well, we'll be offering her a job. So we'll see. We actually have now 2 candidates that are very interested. So this is all exciting. We had, as part of our survey, our work with RICAN, we also have a report from TrueBridge, which is the company that is part of CPSI, and they gave us an analysis of how we're doing. So we've been working on getting that information, following through with their recommendations. I believe you all know we've received our gift, $150,000 this past month from Fritz Culver, who signed a thank you note. This gift was given in honor of Chaplain Tree Kelly and was earmarked to use toward building the ambulance building, something that was of interest and supported for a long time, the Tree and Chuck. So it's a very, very marvelous gift. So let everyone know about it. I think our strategic planning meeting on Tuesday was good, and I appreciate the comments and suggestions on how we can get more information to you quicker. Keep working. Aaron Stewart, long-distance relative of Gerald, will be starting next week working in our clinic 1 day a week. She's a physician assistant, and she will be starting for the month of November and December. She'll work 1 day a week, and then in January move to part-time working 24 hours a week. She'll be starting out in the clinic. She'd like to. The goal is to focus a lot on prevention. So we're excited about her as an addition to our provider. Pardon me?
Team.
To our team. Thank you.
She must not have used Gerald as a reference.
You know, I bit my tongue on that one, Chuck, thank you.
It's true, she didn't tell me of that, but she did use her mother as a reference.
That's always a good one.
We have been involved in the evaluation of our our electronic health record. We're with CPSI and eClinical and Credible and T-System and Point Clinic Care. So we have been looking at staying with the CPSI system or going with 2 possible other solutions, which is Cerner and Epic. A team of our staff will be going to visit the Cerner headquarters in Kansas City and then to a hospital in Missouri right across the river in the last week in November. They picked the best time to go to Kansas City, I'm sure. At least it's not in the month of August or July when it's humid and hot. So they'll be going there, and we don't have yet a time when they will look at the Epic system either through St. Charles or any other system that we might be able to access Epic through. Had a good meeting with the Christmas Valley Board on Monday night, and they are interested in having us rent from them for some of our mental health services, sort of wellness. So we are anticipating starting that process as of today. So using 2 of their offices. They're very interested in having us, and the rent would be reasonable there. We asked Dave to advise us, and Dave said they represent both parties, so we'll not give you any. Thanks, Dave.
Yeah.
We appreciate it. It'd be useless. They also said that they would be happy to extend a letter to us allowing us to provide service in North Lake Health District, and that's through public health. So we have a letter approval for providing mental health services. We needed the same letter for providing public health services. So that's pretty exciting. That concludes my comments. Do you have any questions? I know it's only been 2 days since we had our extensive discussion.
your chance, guys.
Yeah.
Oh, okay. Hearing nothing. Do we need to go to executive session?
No, we really don't. The information that I have, I could provide to you by email. It's not that critical. More information.
Okay, anything else?
What time's your game?
I'm gonna make it. Then, if there's nothing else, we are adjourned at 7:20 almost.
That's a record.
This has to be a wrap.
Eat your heart out.